you've noticed a change. Maybe you gained a little weight, you're particularly sensitive to cold, you feel lethargic. You could have an underactive thyroid. We want to welcome back Dr. J.P. Saleeby, Medical Director at Carolina Holistic Medicine, with more on this condition, and not to be confused with hyperthyroidism. So what is the difference between hypo and hyper?
Okay, so hyperthyroid, which is mostly due to an autoimmune disease called Graves' disease, is where your thyroid is overactive. You have too much thyroid hormone. Hypo means underactive, and in the United States, the leading cause of that is Hashimoto's disease, which is an autoimmune disease. In other areas of the world, it could be a deficiency in iodine or selenium.
Right, and is that why they decided to start adding the iodine to salt?
Yes, exactly.
As a regular practice?
Yes, that's to help, because if a pregnant woman is hypothyroid, it can develop a baby who has developmental delays or cognitive dysfunction.
Okay, how common is it these days for someone to have a hypothyroidism?
Yeah, so it's pretty common, probably more common than we really realize, because it's anywhere, depending on the studies you read, about 10% of women, anyone, just pull 100 women off the street, 10 of those 100 will have hypothyroidism, according to if you do the blood work. Okay, and the blood work has limitations that's done by mainstream medicine. That's usually a TSH, thyroid stimulating hormone, and a T4, a total T4. If you only do those two tests, you're going to miss some women with, or men with hypothyroidism. There are other things you can use. You can use basal body temperature measurements, and there's a whole plethora of others, more specialized tests like free T3 and free T4 and reverse T3 and TPO antibody titers. So there's a bigger panel you can run on patients to catch more cases of hypothyroidism.
But doctors are not just naturally gravitating towards all of these tests. They just test maybe to see if they have a hypothyroidism,
right,
but then they're missing, so that 10% could actually be a much larger number.
That is true. Yeah, so the practice guidelines, which probably are about 20 years old, call for the use of TSH and T4 in screening people, not everybody, just screening those people that look like they might be hypo. Somebody who's gained weight, somebody who has constipation, somebody who's having hair loss, somebody who's having depression. Any patient with depression should be screened for hypothyroidism.
Really?
Because the Prozac may not be the answer. It could be a little thyroid medicine might cure their depression.
Oh, wow, that blows my mind. So, and why don't doctors naturally just test for these things? Why not?
It probably has to do with their training. So medical education, medical school, and then residency training, it just hadn't quite caught up to looking at other options. Now, Dr. Broda Barnes was a pioneer in thyroid in the 1950s. He wrote some papers published in JAMA about using basal body temperature measurements, measuring under your tongue. And if you're low temperature, you might have hypothyroidism. And then Dr. E. Dennis Wilson, in our modern day, is the carrier of that torch and teaches doctors about that as well.
Before we got started here, we were talking a bit about this, that you really have to be your own advocate, and you have to do your own research because you don't know what you don't know. So how do you know what questions to ask your doctor? If you're noticing that you're gaining weight, if you notice that you're really sensitive to cold and all these other symptoms that you had mentioned, how do you tell your doctor, look, I'm experiencing these things, test me for this, 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 and this?
Sure. So there's a couple websites and there's a couple good books. So the website is stopthethyroidmadness.com, I believe, or it could be .org. And it's a nonprofit organization. There's a doctor, she's a doctor of education, is the creator of that. And she's also helped edit and author 3 books. Stop the Thyroid Madness, book 1, 2, and 3. So book 2 is the one with the white cover, and that was written and co-authored by clinicians and researchers. I chaptered the 3rd chapter in that book, and I talk about natural desiccated thyroid, which is the preferred replacement thyroid, not Synthroid. So Synthroid only works in about 10% of women effectively. 90% who take that drug, they could do better with other medications. And it's unfortunate, since Synthroid is one of the top 5 drugs prescribed worldwide.
Oh, wow. And what about natural remedies in which to balance your thyroid and your hormone levels?
Sure. So natural desiccated thyroids come out of the porcine or the pig or the bovine, the cow gland. So those are natural products. Some of them you don't need prescriptions for. Other things like iodine and selenium, and they have to be administered in balance together, or you could get in trouble if you do too much. And then some of the precursor amino acids that are helpful, magnesium, iron, vitamin D, those are all important in a well-functioning thyroid.
And that's why people need to come and see you, because you can keep them in check and keep their balance and do all the tests that need to be done. So for people who want more information, where should they go?
CarolinaHolisticMedicine.com.
Okay. Thank you so much, Dr. Saleeby.
Good being here.
We're back in 2 minutes.